Hi, I'm Dr. Vivek Sharma from Narayana Hospital, Kolkata. We'll be talking about why a knee goes bad. Why a knee goes bad. It goes back to worse with the age. If we take it's from 50s to 70s maybe. This is the age, the group that come to me with the bad knees. There are a lot of factors that can be associated with it. It can be overweight, it can be flat foot, it can be not taking care of yourself, maybe you're not doing regular exercises, and a genetic factor to some extent, which we see in females commonly. With a lot of reasons coming with the broad pelvis and of the mechanical access and all those reasons, the knee goes bad. When it goes bad and it gets worse to grade 4, where you see a curve and people walking with a waddling gait, that is the time you go for surgery. Do not delay, please. That's my request, because what happens, I'll show you here. If you see these ligaments and everything goes bad, degenerates, the medial condyle cartilage, the cartilage here goes back, and you see a curve coming, and then people walk with gait. When these are bad, these surfaces need to be replaced, otherwise the quality of daily life goes bad to worse. This has to be improved. So the best thing is, I'll show you, you have to put this is something called a femoral component, tibial component, and a plastic replacing your menisci. This is called knee replacement or a knee resurfacing with minimal bone cutting, which I do. I don't cut bones a lot, and balance in the tissue all over, and that is required. So after doing these surgeries, patient can sit as down as possible on the floor. They squat at times, they sit cross-legged. They can do everything if they require to. It permits with the age. If too obese, I tell them not to do that. But if patient is lean and thin, he can bend down, squat down, sit down. After 2 months of exercises, gait improves, your life improves, you can go out, you can climb your stairs, you can walk along. So these all things improve daily quality of life. You want to live then. You want to live a life and go out roaming around, visiting a lot of places where you are not able to visit when you had these knee pains. So from my side, the idea is go for knee resurfacing or knee replacement before it's too late, because if you are getting late in this, if you are buying time, nothing happens. Your ankle, your hip, or your spine or sacroiliac joint may go bad, which will take time to heal. At times, sacroiliitis with the inflammation of two joints takes a lot of time to heal. After operation also, it doesn't go. There is a lot of pain at back and coming back to back of the knees. So that has to be solved. So my request is, please take care of yourself. Come and get operated in time. Will help you to solve a lot of problems. Thank you.